morning.
Good morning.
Hi, my name is Cathy. I'm a registered nurse and I'm here to do your physical. And could you tell me your name and date of birth?
Abe Froman, July 4th, 1966.
And today you're here for?
A physical?
Okay. I'm going to be narrating and discussing things throughout the exam. And so if there's anything that you have any questions about or that I say incorrectly, please interrupt me and let me know. So Abe is a 50-year-old white male who seems well nourished, good hydration and nutritional status. Mood is alert and oriented ×3. Mood is appropriate and dressed appropriately. His posture is good. He is sitting upright and appears to have a body mass index within normal limits. So first I'm going to inspect the head. No obvious deformities and anything bothering you, any pain or tenderness? Okay, I'm just going to palpate the head. No obvious deformities, good hair distribution. I'm going to now inspect the eyes. Eyes are clear. I'm going to just touch. Sclera is pink and moist. I'm going to use a light here. You can stare straight ahead. Pupils are reactive. And now I'm going to assess for consensual. Okay. If you could stare right here at my pen light. Okay. Follow it. 6 cardinal fields of gaze. Very good. Pupils should equal around, react to light, and accommodation. Can you clench your teeth for me? And can you stick out your tongue? Okay, very good. Now I'm going to palpate the sinuses. Let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
I'm now going to inspect the right ear. No obvious deformities, drainage, or anything. I'm going to palpate the auricula and the tragus. Any pain or tenderness?
No.
Same on the left side. I'm going to inspect. No obvious deformity, drainage, or any abnormality here. I'm just going to palpate. Now moving on to the mouth. Lips appear a little dry, but they're pink, moist. Or pink and slightly dry. No cyanosis. Got good coloring. Can you open your mouth? And stick out your tongue, and I'm going to shine a light. I do not appreciate any tonsils, so you must have had your tonsils removed.
Yes, I did.
Okay. And the uvula is midline and does move up and down. Next, I'm going to look at the nose. No obvious deformity of the nose. I'm going to occlude one side, and I want you to breathe through the other side. Any issues?
No.
Okay. The other side. Any issues?
No.
The nares are patent bilaterally. Next, I'm going to feel your lymph nodes. So starting with the preauricular, posterior auricula, occipital, posterior cervical chain, anterior cervical chain, tonsillar, submandibular, submental, and the supraclavicular. No lymphadenopathy appreciated there. Next, I want to check your range of motion of your neck. Can you move your head forward and back and side to side? Okay. And now can you turn your head and resist my hand? No, the other way, towards my hand. Okay. And this way. Okay, very good. Now I'm going to put my hands on your shoulders. Can you raise your shoulders and resist? Okay, excellent. Strength is equal. Any pain or tenderness?
No.
Equal bilaterally. The trachea appears midline carotid pulse. +2 easily palpable carotid pulse bilaterally. Now, if I could have you face the wall, please. I'm just going to open your gown a little bit and inspect the back. Posture appears good, no obvious deformities of the back. I'm going to place my hands on your back. If you could take a deep breath in out. Chest rises equal bilaterally. Okay, I'm going to percuss the back. Just going to feel me tapping a little bit across your back. Very good. Okay, now I'm going to perform what's called tactile fremitus. Every time you feel me touch you, if you could say the words 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Thank you. I'm going to be listening to your breath sounds posteriorly from your back. So if you could just, every time you feel my stethoscope move, if you could just take a deep breath in and out of your mouth. Test before I move around to the front. You're going to feel me just tap your back and let me know if you feel any pain or tenderness. Any pain or tenderness? No pain or tenderness? No CVA tenderness. Okay, if I can have you spin around. I'm just going to add, this is anteriorly to your chest as well. Same thing, every time you feel my stethoscope, take a deep breath. Very good. Okay, you can breathe normally. I'm going to locate the apical pulse, which is 5th intercostal space mid-clavicular line, and I'm just going to listen to your heart rate here for a second. Okay. And now I'm going to listen in the ape to man format, the aortic valve, harmonic valve. Tricuspid, and mitral. Breathing, no obvious work of breathing. Breathing is regular, no accessory muscle use with respirations. Lungs are clear anteriorly and posteriorly, bilaterally. Heart rate is regular, and probably with the normal, around a 70 beats per minute, S1, S2, no murmurs or abnormal heart sounds appreciated. So now moving on to your upper extremities, I'm gonna look at your arms. Inspection, no obvious deformities, well nourished, good circulation. I'm gonna check your nail beds for capillary refill. Capillary refill is brisk. Nail beds, the nails, there's no clubbing. They're nice and pink and with excellent capillary refill. Okay, I'm gonna test your range of motion. Put your arms out and up, to the side and down. Excellent. I'm gonna ask you to lie back. Pull this up. Okay, come on, scoot back for me. Okay. Oh, probably good enough. All right, so I'm gonna have you put your hands at your side. Any abdominal pain or issues at all?
No.
No? Okay. Just gonna listen to the abdomen. It appears slightly round. No obvious deformities. I'm gonna listen, starting at the right lower quadrant. I'm also gonna listen over the aorta. Bowel sounds are active, all 4 quadrants. I'm just gonna tap. Any pain or tenderness?
No.
Okay, I'm gonna start with light palpation. Let me know if any pain or tenderness. Any pain or tenderness?
No.
Okay, deeper palpation now. See. Any?
No.
Okay. Abdomen is soft, non-tender. I can feel the upper lobe of the liver slightly in the right upper quadrant. The spleen is not palpable, no palpable masses or abnormalities identified. Moving down to the lower extremities, I'm just going to inspect. I do see a previous scar on the left knee, I'm assuming from knee surgery,
Yeah, so that's correct.
and a few scars on the right ankle.
Yeah.
Again, they look like post-surgical scars.
Yeah.
Okay, I'm going to just feel for some pulses. Dorsalis pedis is +2. Posterior tibial is easily palpable. Bilaterally, +2. Okay, I can have you raise your leg up. And bring it up and bend the knee. Okay, good flexion. And we're gonna do adduction and abduction. Good range of motion on the right. Same thing with the left. Let's raise up and bend. Adduction and abduction. And then we'll straighten. Okay, I'm gonna have you come on up. Lay down. All right, next. I failed to test your eyesight, so if you could cover one eye for me, please. And then about 12 inches apart, hold this and read a line for me.
Ferris Bueller. Everyone loves him.
Okay.
He's a very righteous dude.
Okay. And if you could cover the other eye for me, please. Okay. Can you read a line?
Life moves pretty fast. If you don't stop and look around, you might miss it.
Okay. Now I'd like you to close your eyes, and I'm going to touch you with a cotton ball, and I want you to tell me where I'm touching you with the cotton ball.
Cheek.
Which cheek?
Left.
Okay.
Right cheek. Right arm. Left arm. Right arm.
Upper or lower?
Lower. Left arm lower. Right hand. Left hand. right leg. Right leg lower. Left leg. And left leg lower. Right foot. Left foot.
Okay, excellent. Patient has good sensory differentiation in upper and lower extremities bilaterally. Okay, now let's test some reflexes here. Just need you can unclench your hands and just relax your hands.
Okay.
And I'm just gonna tap a little bit. And check your brachial reflex. There it went. Just relax, just
Okay.
relax your hands. Excellent. All right. And now, same thing with your legs. Just relax your legs.
Okay.
And I'm going to check the patellar reflex. Oh, yes, very good. And same thing, just relax. I'm going to check the Achilles now. Excellent. And this is the one that had the ankle fusion, right?
Yeah.
I don't know if the ankle fusion, I'm not feeling much. I think it's related to post-surgical issues. And now the plantar. It's the tickle.
Oh, yeah.
Okay. Same thing over here. Tickle, but
Yes.
you don't see a Babinski sign, which is what I'm. Now I'd like you to do. Can you pick up this leg and touch heel and slide it down your shin, please? And the other side. Good coordinated movement bilaterally. Can you put out your hands and flip them back and forth? Excellent. Okay, now I'd like if you could walk across the room. I'm just going to observe your gait. Gait is steady. With good posture. Okay, now can you walk heel to toe for me? Well, not just heel to toe.
Oh, whoa, okay, sorry.
No worries. Good coordinated posture, steady, with good coordination, and no concerns. And one final test I believe we have, if you could face me, and put your arms out, put your feet together and your arms out. Okay, and now close your eyes and lift one leg. This is the Romberg test.
Okay.
He's a little unsteady, I'm not sure. There, that's
Define my
excellent.
center.
Okay, and I did spine range of motion. If you could lean back and forward and twist side to side. Any pain or tenderness or
No.
issues there? Okay, well, that concludes our test today. Thank you, Abe.
Thank you.